The World Health Organization is warning of future global pandemics, and it's pressing member nations, including the U.S., to sign on to a treaty giving the organization broader authority. But as Lorie Johnson reports, the WHO's questionable decision-making during COVID is raising some red flags.
WHO Director General Tedros Ghebreyesus suggests the next pandemic could be possibly more deadly than COVID-19.
And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X.
Given his concern, Tedros wants countries worldwide to sign a legally binding agreement full of rules and regulations giving the WHO expanded authority. This 32-page document is the most recent draft of the so-called pandemic treaty that the World Health Organization promotes as a way for poorer countries to receive the same level of health care as wealthier ones. Some Capitol Hill lawmakers have major concerns about this push, including the WHO's handling of China's role at the beginning of the coronavirus pandemic.
The WHO denied that COVID-19 was spread via human-to-human transmission, based entirely upon the word of the Chinese government, the CCP. And I think maybe most appalling is the WHO even delayed naming the pandemic a public health emergency of international concern because the CCP confirmed that the spread of the virus was, quote, under control.
Others charge it would use U.S. tax dollars to fund certain health policies worldwide.
You know, WHO has lost its way. I used to ask them, I've been here 44 years, year in and year out, where do you stand on abortion? They'd say, agnostic, we don't do anything on it. And now they have become the most aggressive promoters of abortion in the world. They have and it's embedded in this treaty.
The Family Research Council's Tony Perkins calls the treaty a progressive power grab.
The draft agreement is first and foremost a global, political, economic, and social manifesto
that threatens U.S. sovereignty.
Few Americans, save those who desire to exercise control over the lives of others, would want to see another pandemic like COVID-19 and the government response that followed that pandemic.
Given the scope, critics say this amounts to a treaty and should be put to a vote in the U.S. Senate.
The WHO refuses to call the pandemic treaty a treaty. It calls it an agreement, an accord, a framework, anything else, likely because it does not want it to be submitted to the treaty process in the United States and worldwide.
Another major sticking point is that approval would allow vaccines, treatments, tests, and other information to be shared.
The draft would require parties to support time-bound waivers to intellectual property and use WHO TRIPS provisions to override intellectual property rights, which will curtail future investment in health research, which is exactly the opposite you would want to respond effectively to a future pandemic.
Experts say that information sharing could be a deal breaker for the U.S. and other nations. WHO leaders have set a May deadline for the document's approval. Lorie Johnson, CBN News.